the healthcare industry is still feeling immense effects from COVID-19, especially as we're talking today about a dwindling workforce, a changing workforce. According to the Texas Workforce Commission, 23,000 registered nursing positions are still unfulfilled, which means a lot of patients don't have the access to care. And so, Dan, can you set the stage for us a little bit and talk about the healthcare landscape before COVID and the changes you've seen over the past 3 years?
Sure. Thank you. Good afternoon, everyone. Before the pandemic, we saw travel nurses accept contract assignments to go see new cities, to build their resume, and for a sense of adventure. Through the pandemic, demand increased for staffing in every single healthcare facility, and travel nursing demand really skyrocketed. And we saw nurses leave staff positions to take travel assignments for the first time ever. And really the major motivator was money. And this was a new dynamic. I think it was very new for nurses to have to get out on the road, to live in a city that they weren't accustomed to get used to a new facility, especially a facility that was probably under a great deal of stress and pressure. Through that, burnout increased, nurse-to-patient ratios got stretched, and we saw clinicians completely leave bedside, which further made this problem even more acute. So, what's happening now? Well, as census has somewhat normalized and dropped, we've seen the demand for travel nursing also drop, and pay packages have declined. We're seeing nurses go back and accept staff jobs, or maybe reapproach their original facility. And I think that doesn't mean, though, that the staffing demands at these facilities have been met. And so we're seeing the facilities be really creative about trying new techniques to fill the shortages, creating internal resource pools. In acute care facilities, we're seeing facilities hire more LPNs to help out along the RNs. We're seeing more CNAs be hired. We're seeing virtual sitters and sitters to take the jobs of the CNAs to free them up. So there's a wide variety of techniques that I think we're seeing healthcare facilities do to continue to combat the staffing shortage.
I think that it's good as we're reflecting to also talk about last year in 2022, which saw massive upswings in hospitalizations for things like RSV and flu. How do companies like Advantis determine where to send nursing staff, especially when responding to things that might be unexpected or seasonal changes in health needs? I'm wondering, is there like a normal baseline anymore? Or is that kind of out the window?
Yeah, out the window. But, I think in 22 with RSV, we saw spikes in pediatric nurses and the demand for them. ED nurses were in great demand all over the country. And right now, currently, med-surg seems to be the hot specialty of the day. We use, at Advantis, we use BI and technology to kind of monitor demand. We can watch it daily, weekly, and monthly and see the spikes. It's easy to, watch the demand. The much harder part is making successful placements and matches with facilities. And we choose to partner with facilities who we could, form strong business relationships with, who actually treat the clinician like part of the staff and not just a contractor on the side. That is an issue in travel nursing where the travelers feel like almost like second-class citizens and not part of the team. And so we choose to focus where the facility treats them like part of the family, and where we can have long, successful placements that increases the care levels and the satisfaction for all parties involved. And then also, part of the matching process does require, the pay to match the nurse's needs. And so that's a tug of war that's happening right now. The facilities are trying to bring down bill rates, and nurses are kind of digging in their heels in some situations to kind of maintain that elevated pay. When we're placing travelers, we're hyper-focused on really two phases. One is getting the clinician successfully onboarded. I think far too often we kind of throw nurses onto a floor, and the onboarding process can be very disjointed. When you're traveling to a new city, that's stressful enough. Starting a new job at a new facility, that's also stressful. So we want to make it a smooth experience, making sure that their housing is taken care of, making sure that they have first day instructions, they know what to expect. And then that first day and first week, really get off on the right foot. From there, it's about constant communication throughout the assignment, which is incredibly important. Are they working the hours and shifts that they desire? Are they in an environment where they can thrive and they can provide great care? Nurses want to be great at their jobs, and are they able to do so? Do they have a good working relationship with their unit manager and their coworkers? All very important things. We've talked a lot about burnout, and I think and mental health, and people maybe jump to, okay, well, we need to offer therapy, and maybe that is the case for certain clinicians. But there's also a large continuum between no support and therapy. And so what do you do in that area? And I think for us, we have clinical directors who work at our staffing agency. These are former unit managers, former ICU directors, and they act as like a career coach and an advocate for the nurse. They're available for coaching and issue resolution and crisis resolution. And they're there to be somebody just to maybe the nurse needs to vent to, or they want to brush up on some of their clinical skills prior to starting an assignment. I think those little bits of support can make the experience so much better, keeps the clinician happy, which improves the quality of care. And I think the community, the healthcare facility, and the clinician all benefit.
Sometimes it can feel pretty overwhelming to have conversations like these and list every single issue that might happen in the industry, and figuring out kind of where to start when there are so many places to fix can be a little overwhelming. I'm wondering for y'all, for anybody, what feels like a kind of easy first next step, or maybe easy is incorrect, but what is the first step in trying to address this nursing shortage? Where is kind of that kernel that someone might start with or think about starting?
I'll talk to the providers on the phone and on the call today. I think for folks that are thinking about traveling or getting into taking a contract type of assignment, it's really important to find an agency that's going to support you. I think clinicians today, there's a percentage of the population that honestly, they want a completely digital experience. So they're using some of these staffing platforms and apps. Bob alluded to one earlier, the My CNA Jobs, and they prefer that through the cycle. But there's a lot of staffing companies who, they're more of a brick and mortar staffing company, and the recruiter will really act as your agent. They'll educate you on the process, on pay packages, on the facilities that are going to place you in. And it's a way, I think, for the nurse to maybe get a preview into a potential assignment, as opposed to maybe the more traditional way where if they're just applying to one facility, they don't have a broader view of the market. So there's a lot of different agencies, a lot of different avenues out there. I think it's about finding the agency that's going to support the clinician the best. The status quo is not working, and there's breaks occurring in the industry. When you look and hear, over 50% of healthcare facilities are running negative margins. They are losing money. That cannot sustain itself. These facilities will go out of business. And that's the worst thing. And, we're seeing even, negative events from some of the negative margins. You're seeing hospitals close floors and units in their facilities. So now the community is suffering. If they don't have a certain surgery center is now no longer open, or certain floors no longer open, and they have to, patients have to travel even further to get this care. Unless we address the money piece and get these healthcare facilities on a stronger financial footprint, there's going to be this tension in the space in the market, and it's a huge problem. We have to fix the money piece. This problem is even larger for, unfortunately, our small and rural healthcare systems and facilities. The issue is, the large facilities have purchasing power. They're part of big GPOs. They can buy equipment and supplies at lower rates than maybe a small facility could. And what we're seeing is, the smaller the city, the more rural the town, there's at times when they have to pay a premium to the cost of living that you would see in a large city. And that makes it's this, this cycle that's incredibly difficult for these facilities to turn a profit. So absolutely, pay does impact quality of care for the individual who asked the question. And it's interesting because every facility, there's some facilities that are incredibly well run. And let's be honest, there's some facilities that aren't run as well. So the administrators also, bear a burden in becoming better at running their systems, being more innovative, trying new things so that they can, pay the clinicians more than a fair wage.
I'm so grateful for everyone's time. I'm so grateful for all the incredible questions. And I will turn it back to Bob for our closing remarks.
Thank you, Elena. Thank you, Elena, for moderating for us. And thanks again to all of our panelists for being part of the conversation, and to each of you who joined us here today about the various perspectives. Hopefully, you can take something out of this, take it back to your organization, and at least start a conversation or have some conversations. But we all play a part in strengthening Texas for the future. And this is about the future. We have today where we are, but we also have to look where are we going with all this. So, it's about collaboration, and all of us may be competitors in different markets and different parts of healthcare, but at the end of the day, we're all there really to care for, our Texans, and we want the best for them, and we have to work together to get that done. To learn a little bit more about Molina's work in the state, you can go to molinacares.com, and that's also going to have some more information about what Molina has been doing in terms of workforce development. So thank you to everyone again for joining us today, our panelists, to our guests, to Elena, and everyone have a great afternoon.